Welcome to the South Central Telehealth Roundup. Today's topic is injury prevention during the pandemic, presented by the Injury Prevention Center at Arkansas Children's. A little bit about the South Central Telehealth Resource Center. We are a federally funded nonprofit program funded by the Health Resources and Services Administration out of the Office for the Advancement of Telehealth through the Department of Health and Human Services. Being a federally funded entity, we cannot promote one vendor or any one entity over another. And the benefit of being a federally funded entity is that the services we offer are free. So if you look at the map here, the South Central region is located in red. We represent Arkansas, Tennessee, and Mississippi. And if you are joining us today outside of that region, feel free to contact us and we'll put you in contact with your telehealth resource center, or we can see if we can help you out in the meantime. There are 2 national centers beyond the 12 regional telehealth resource centers. The Center for Connected Health Policy is our go-to place for all things policy related. They track legislation as it relates to telehealth on the state level, on the federal level, and they have really good up-to-date resources as policy relates to COVID-19 during this public health emergency. And our other national telehealth resource center is the Telehealth Technology Assessment Center, which is our go-to place for all things technology related. They have workshops, they have product reviews. So if you're interested in that side of telehealth, I want to encourage you to go there. So what do telehealth resource centers do? We try to meet you where you're at on the road to telehealth and take you where you want to go. And whether that's talking to you about equipment, does your program need a fully decked out telehealth card, or can your program get by with just an iPad and some encrypted broadband? We'll talk to you about policy, and we'll refer to the Center for Connected Health Policy, the National Telehealth Resource Center that I just mentioned. We'll talk about practice guidelines, business models. We will do whatever we can to make your program successful. So I want to encourage everyone to check out our website, learntelehealth.org. We have webinars, we have modules. We're pretty frequent with social media and blogs. You can sign up for our newsletter, a ton of resources as it relates to telehealth. So I want to encourage everyone to go there. And this recording of this webinar, this is where you can find it, is on that website. Here's my information, Joe Schaffner, my phone number, there's my email, and then there's also the generic contact information that goes to the whole team if you're interested in reaching out. So bookmark that, put it in your pocket, reach out later. You have a question, feel free to contact us. So today, our very special guests, Hope Mullins, Lisa Payne, and Shannon Porter with the Arkansas Children's Injury Prevention Center. Or is it the Injury Prevention Center at Arkansas Children's? There's an official way to say that, right?
It's Arkansas Children's Injury Prevention Center.
Oh, okay. All right. Arkansas Children's Injury Prevention Center. Okay. So a little bit about our speakers today. Hope Mullins is the director of the Injury Prevention Center. She has over 20 years experience working in injury prevention and research. She works closely with faculty and staff to develop and implement evidence-based interventions. She has been the project director on research and programmatic awards from federal, state, and foundation agencies. Ms. Mullins earned a master's in public health with an emphasis on health education from the Faye W. Boozman School of Public Health. Lisa Payne is the infant mortality prevention coordinator through the Injury Prevention Center at Arkansas Children's. Lisa earned her Bachelor's of Science in Psychology and Sociology from the University of Central Arkansas at Conway. She has 35 years experience working in prevention with at-risk youth. Lisa facilitates safe sleep and safety baby shower trainings across the state and serves on safe sleep and period of purple crying task forces at Arkansas Children's. She is also a child passenger tech and instructor. And finally, Shannon Porter, the Injury Prevention Center's outreach coordinator, joined the team a year and a half ago. And prior to becoming a member of the Injury Prevention Center, Shannon worked in Texas as an investigative newspaper reporter, and most recently as a communications and social media specialist for the University of Texas Medical Branch in Galveston. Though new to the world of injury prevention, Shannon is passionate about education and communication and has drawn from her experience in storytelling, social media, and marketing and public relations as a way to highlight the work of the Injury Prevention Center and connect with a variety of new audiences. Ladies and gentlemen, I will turn it over to our guests.
Thank you so much, Joe. I'm going to try to share my screen really quickly. I hope everyone can see that. There we go. All right. In case you're not familiar with the Injury Prevention Center at Arkansas Children's, we are the only pediatric-based injury prevention and research center in Arkansas. Our mission is to reduce injury, death, and disability through service, education, innovative research, and advocacy. We started as a research. Yeah.
I'm sorry. It's showing the presenter view.
Oh.
What we're seeing is the presenter view, so it shows both your slides at the same time.
Okay, so what would be a trick to fix that?
I tell you what.
Here, let me stop sharing and let me try one more time.
You should be able to toggle between screens which one you're showing.
Okay, did that work?
No, it's still the same. I'll tell you what, would you feel comfortable if I did the PowerPoint?
Absolutely.
For mine? Okay. Let me pull it up real quick.
I'm in a meeting. Sorry. Are we ready?
Almost. Here we go. And boom, there we go. All right.
Thank you. All right, Joe, you want to advance to the next slide, or can I do that? Okay. All right. So I always like to start with a little bit of data when we talk injury prevention, and I know this slide is really busy and the numbers are really hard to see, but what I really want everyone to look at and concentrate on is the colors. So as you'll see, this is the leading cause of death for Arkansans from 2015 to 2019. And when you look at those blue squares, those are unintentional injuries. So as you can see, injuries are the leading cause of death for anyone under the age of 44. And when we talk unintentional injuries, we're talking things like drownings, bike crashes, motor vehicle crashes, Arkansas ATV crashes, firearm injuries, and a lot of other things. The red boxes, as you can see, are homicide. And so for those, we're talking firearm injuries, we're talking, unfortunately, child abuse and assault. And the green boxes are suicide. A lot of people are frequently shocked to see that suicide is the second leading cause of death for kids 10 to 14. And because of this information that I'm showing here, this is why Arkansas Children's Hospital has invested money in our injury prevention center, because our goal is to drive down the leading causes of death for kids and keep our families healthy and safe so they can have long lives. So you can go to the next slide, Joe. So I was talking a little bit about the Injury Prevention Center and our mission. We started as a research center trying to identify gaps in the field of injury prevention and figuring out how we address those gaps to keep families healthy and safe. And we then eventually morphed our research into some outreach and education in the community. And we also do training, lots of technical assistance and training in the community. We also train health professionals and advocacy, working with the state to make sure that we have strong laws that help protect families and kids. So next slide, Joe. So now we're going to talk a little bit about the priorities that the Injury Prevention Center addresses. One of the programs we hold that is funded through the Arkansas Department of Health is the Infant and Child Death Review Program. This program reviews all unexpected deaths for kids under the age of 18. So if a child dies from cancer or birth defects or the flu, we don't review those cases. So most of the cases we're reviewing were on that previous slide, the blue, green, and red squares. When the whole point of the infant and child death review is to delve into a child's death so we can look at how we can prevent that at the community level. And sometimes that is a systems change, sometimes it's a policy, and sometimes it's just public health education. This is a multidisciplinary team. We have 11 of these teams across the state, and they have coroners, law enforcement, public health professionals, medical field, crimes against children, DHS. We bring in other extra experts if we need them for a specific case. So it's a very multidisciplinary team that is a local team looking at their local data. So as you can imagine, when COVID hit, these teams that were meeting in person quarterly, 11 teams around the state, suddenly were not able to meet. So we had to move into a virtual world for them, which was a little bit challenging for us because it wasn't as easy as just saying everybody get on Zoom, because we are looking at autopsies and we're looking at police reports and confidential information. So we had to utilize a system that was able to protect the information that was being shared. And then the other struggle with getting the teams to move to virtual is that we were dealing with people who aren't necessarily tech savvy. We have coroners in the state who still do everything on paper. They don't even own computers. So now all of a sudden we're asking them to not only get access to a computer, but to also learn how to navigate a virtual world. At the beginning of COVID, this worked great. We had lots of team engagement. We had more team members showing up than normal. And over the course of the last year that we've been in COVID, our number of participants in our virtual meetings for the infant and child death review program have dropped off. We haven't been able to figure out why. So we've actually starting to work to going back to those meetings in real time. I think part of it was at the beginning, everybody's priorities shifted. Most people were at home, so it was easier for them to connect. But now people's jobs are starting to open back up, and they're getting back to going into their somewhat normal life. So that could be what is impacting the virtual ability for these teams to work together. Any comments or questions about our infant and child death review program?
And feel free to use the Q&A function or the chat box if you're interested in interacting with our panelists. We'll keep it as casual as possible.
Okay, great. We also address motor vehicle across the age spectrum from birth all the way up to teens. We do child passenger safety education and training technicians across the state. Our child passenger safety really addresses infants, babies 0 to about age 8. And then we have a pilot program we're doing for tweens 8 to 14. And then we have a teen program. As you can imagine, trying to do child passenger safety virtually has been nearly impossible because it is really hard to work with a parent to learn how to put in their car seat if you can't be hands-on with them. This is something that the entire country has struggled with for child passenger safety. We've worked with lots of partners, been on lots of group chats. So we were able to figure out a way to kind of FaceTime one-on-one with families, have them touch their car seat, and then we could guide them on how to install their seat, have them get their cameras close. But again, one of the struggles with doing car seats virtually is sometimes families are limited in the amount of data they have. And so asking them to kind of stream us so we can see what's going on was difficult for them. The other difficulty in our child passenger safety is that the training that we do to certify technicians across the state is a national curriculum that did not have a virtual component. And we were unable to do any of the training virtually. That national program is now developing a virtual component, but a lot of this again is hands-on training. It's training somebody how to pick the right seat for the child and then put that child in the seat safely and correctly, and then install that seat in the car. And trying to teach somebody how to do that in a virtual world is a little difficult. So everybody across the country is trying to figure that one out. Some other areas that we address in the IPC are recreational injuries. So for us, it's drowning. It is bike and pedestrian safety, ATV safety, a little bit of hunting safety. For us, we use lots of partners for this. So we relied on our external partners to continue to address this issue during the time of COVID. So for things like boating safety and hunter's ed, those are already had an online virtual component. So they were able to continue with that education. We partnered with some groups in Little Rock to do Bike with a Cop, which has been an annual program that has been going on. And this year they turned that into kind of a drive-by where the cops just kind of had bikes outside and people drove by and got education in their car so that it wasn't a big group getting together during the time of COVID. In our ATV safety, luckily, a lot of that was already on a digital format. So we were able to continue to provide that to groups who wanted to do ATV safety. And for intentional injury, we really, we struggled with this because this is where we talk suicide prevention, and we had just launched a support group for families with teens who had had an attempt right before COVID. And then when COVID hit, we had to obviously shut everything down. And we worked with our mental health partners who really felt that a virtual world was not the best avenue to continue to support these families. So we've struggled in that realm. But what we have done is we've begun working on a website to kind of address some of the issues that we would have been addressing in the public. In Arkansas, there's a lot of players in the field of suicide prevention that don't necessarily talk to each other. So over the last couple of years, Children's Hospital has been a convener for those groups, bringing them together. So having a website where families, practitioners, teachers, school professionals, other people in the community can go and find all the resources that are available in Arkansas in one place is going to be really important. And I did forget to mention in motor vehicle safety, we do teen driving. And that is not teaching teens to drive, but helping families have conversations around teen driving safety, because evidence shows that if parents and teens have a written contract, those teens are going to have less crashes and less deadly crashes. Most of that is school-based work. So at the beginning of COVID, schools shut down. We weren't really able to do anything with the schools very much. And as the fall approached and we started working with schools and trying to get in and into their virtual world, we have really struggled, because just as the time when we get a school to say, yes, you can do this virtual presentation, then we'll get an email the next week saying, oh, sorry, our school is shut down because we have a big outbreak of COVID. So again, another area where we have struggled. But recently, in the last couple of months, one of the programs that we've always supported is the Youth Accident Prevention Program, and they turned to the virtual world, and they are now actually in the schools in Pulaski County doing week-long education sessions. So we've been able to pick that up. What we found is interesting with our partners is at the beginning of COVID, we knew we were going to have to try to figure out how to go virtual, but when we were talking to our partners about how to do that, we got a lot, wouldn't necessarily say pushback, but I don't think our partners were looking to the future and how far we were going to have to be dealing with COVID. And so they didn't really start moving into any virtual world until this spring. So that's where we kind of are with a lot of that. And I will let Lisa talk about what she does in infant mortality.
Okay, my name is Lisa Payne, and I am the Infant Mortality Prevention Coordinator. And so when the pandemic hit, we were sent to work from home in March, and we were in the process of revising our curriculum. So our curriculum, our safety baby shower curriculum. And this is our safety baby shower guide. So we were in the process of revising that curriculum, and it was revised in April, and I had my first virtual safety baby shower at the end of April. And a safety baby shower consists of safe sleep, home safety, abusive head trauma or shaken baby syndrome, and child passenger safety in hot cars. We go through every topic and we address everything. I I've downsized the training to where it's just 1 hour, because we found that, you know, that's about how long someone could stand to be in a Zoom meeting with an hour. And so we revised it down to where it can be that and have questions and answers. One thing is that it took a whole village to get this going, because we had many things that we had to overcome. First of all, the first barriers that we had to overcome was just learning the platform. I mean, the platform was something new to me, and I'm not the most computer savvy person, but I was determined to learn. And with the help of some coworkers, Shannon, Amanda, and Lori, we were able to host the first safety baby shower at the end of April. And the really cool thing about doing virtual training is that you virtual thoughts straight. First of all, the pros about doing it virtually is that I can train or educate people anywhere in the United States, anywhere in Arkansas. They can come to my training. And the things that stood in the way was childcare sometimes and transportation. And now that was not a barrier anymore. So it was really positive to be able to host a safety baby shower and invite folks to attend. I have done safety baby shower, train the trainers, and my safety baby shower and safe sleep training. I've trained 186 moms to date in safety baby showers and trained about 68 staff. We started small. We just started with Pulaski County doing their safety baby showers, but then I added some of my other safety baby shower sites and developed partnerships with folks in the county for them to deliver the products. So we have Lake Village, and we have Helena, and our last one that I just added was Arkadelphia. And it's going very well. In fact, everybody wants to be able to keep doing it like this, because they said we've never had this kind of turnout in attendance. And I feel very positive about it. A learning curve for myself too was learning how to engage people in the social media, in that platform, because I'm real hands-on and I love to engage people and I like to ask questions and get them involved. And so that took a little bit of effort on my part to figure out how to do that. But I do think it's been very successful. And it was very important for us to continue to develop relationships in these other counties to be able to deliver our products.
Lisa, do you want to talk about some of the barriers that your moms have had engaging in the virtual world with you?
Sure. So some of the first barriers were the fact that they had never heard of Zoom. And so I did a lot of hand holding. I did a lot of phone calls and walking them through, okay, you have to download this app and then you have to do this, and actually just walking them through the process. And then, I mean, we always tried to mute them, but sometimes they would unmute themselves. And I always said, everything you say when you're unmuted, I hear. And we heard a lot of cussing and a lot of talking about boyfriends and stuff. And so we'd have to go in and try to figure out who had unmuted themselves. And so that was an educational piece as well. And then the lack of internet in some of these rural counties. I mean, I decided I wasn't going to let it be a barrier, though, the internet. And so I've done several safety baby showers just over the phone, talking to moms on the phone and walking them through the safety baby shower guide and giving them the education. And I think it's really important, because people didn't stop having babies during the pandemic, and we were still losing babies during the pandemic because of unsafe sleep environments. So it's really important for me to make sure that everyone was educated.
And Lisa even got to do an international safety baby shower training.
I did. I had a mom from Jamaica that reached out to me and asked if she could attend my safety baby shower. And I told her, I said, if you can figure out how you can be on Zoom or we can be on the phone together, then we can do it. And we started out doing it on Zoom. And then I ended up just calling and talking to her because her internet reception was so bad. She just kept freezing and freezing and freezing. So we just talked through the process, and it was really, it was nice. I've trained folks from injury prevention out of state, and I've trained folks all over Arkansas.
And Lisa moving into virtual safety baby showers was kind of the first virtual education component for Children's Hospital. So when we announced that had happened, then Lisa got to be kind of the technical advisor to other groups within the hospital as they started opening up to doing virtual things in the community as well.
That's great. That's amazing.
You know, and I'll say too, in which I share with people, is one thing is that you can't be too hard on yourself, and you're always going to have some computer glitches. Okay, something's going to happen with the computer, something's not going to work, and I just would always tell myself, Lisa, you're in the middle of a pandemic. You're doing okay. It's all right. And I would just go through it, and I wouldn't get all bent out of shape because something happened. I'd say, okay, you guys, we've got a little glitch here. We've got to work through this. And I'm thankful that I have good internet reception.
And the other thing I would think for the safety baby showers that we've done in the past, we've done some evaluation of that program on paper, some pre and post tests, some pre-tests, and then follow-up tests. And we've actually been able to wrap that into the virtual experience as far as registration and having QR codes that families can scan to do the evaluation component. So it's actually kind of eased some of the burden on our team as having to take those data forms and enter them in a system, because now it's kind of electronic. All right, Shannon, you want to share your experience?
Sure. Well, Hope and Lisa have both talked about kind of how we've navigated this last year. But one of the things, from an outreach and marketing standpoint, I think COVID really brought to our attention things that we do really, really well in the Injury Prevention Center, and then things that we could also improve on. What we do really well is, we meet people where they're at in the community and share with them the information they need. But one thing that we learned pretty quickly early on was that, there were parts of our communication model, in a sense, that could be improved. So we currently are underway of revamping our website that's hosted through Children's website. We realized that we didn't have a lot of the resources there that we needed. We were having to send, separate PDFs. It just wasn't efficient, but we realized that we could make it kind of a one-stop shop for everything injury prevention. And we realized also during the pandemic how many different people, partners, and everything needed those things. Like Lisa's safety baby shower guide, I can't count how many times people called wanting, copies of that. We could, we learned that we could put that somewhere where we could just send them to a link. And then also, during this time when so much information is out there, we really saw how important it was for us to be intentional with our messaging. I feel like every day, even as things are getting slightly more normal now, there's still so much information that's going out there, and we only have a very short window to communicate very important messaging. So I know I've worked with Hope a lot, and Lisa, and our whole team about, we only have a very short time to capture people. So we need to share the most important information we can in that short amount of time. So we've identified areas, across the hospital, across the entire system, of where we could communicate to people. So, and we've also really kind of leaned into embracing social media. My background in social media was, I used to manage the institutional presence of the University of Texas Medical Branch social media. And so taking that and kind of, coming here and really, deciding what and how we wanted to communicate. We learned that, in terms of our families and the communities that we serve, they're not really on Twitter, but researchers and other injury prevention specialists are. So we had to find ways to reach our communities in a different way. And one of the things that Hope kind of mentioned was in our teen driving program, we really had to, I think the word we used earlier was pivot, even though we don't love that. We had to really figure out a way to reach these teens when we couldn't get into the schools like we normally did. So I guess it's been, the other day I looked, I think it's been about 6 months. 6 months ago, we started an Instagram page as a different way to reach these teens, because we know kids are on social media. We know they're on their phones. So we started this page through our Drive by the Rules Arkansas program, where we share posts every week, usually 2 to 3 times a week. We're sharing posts related to like teen driving trivia, kind of like wisdom for new drivers. We do fun activities and interactive quizzes and stuff where we're trying to engage with students. And it's been a new frontier because, we have a presence on Twitter for the Injury Prevention Center, and that's where, a lot of researchers and other injury prevention advocates are and stuff like that. But when it comes to, meeting kids right where they are, Instagram, we had joked about getting into TikTok, but I think I'm 34 years old and I'm too old for that, but I wasn't ready to dive into that. But yeah, it's been really interesting. And it's also, I attended a webinar the other day with the Child Safety Network, and it's been really awesome to kind of see, just all the different ways that the injury prevention world has come together to continue sharing this message. Because Hope will talk a little later about how just because, the world has shut down as we know it, injuries haven't stopped. If anything, they've shifted. And so earlier this year, it was in November, we participated in the inaugural Injury Prevention Day hosted by the Injury Free Coalition for Kids. And because of the pandemic, that was completely virtual. I, on behalf of the Injury Prevention Center, participated in a Twitter chat. There were literally parts of the country, monuments lit up green all across the United States. So it was cool to see that something that typically would have been a very big community event went virtual, and it was still just as impactful. It was really amazing to see how many people were reached, at a digital virtual level. So that was really cool. We've also, like Hope talked about earlier, have really, leaned on our partners during this. I know that's been, different community partners and stakeholders, but also when communicating these messages, we've had to really lean on our partners at Arkansas Children's through like the marketing department. Interviews and media coverage has totally shifted during the pandemic. I know Lisa and Hope have both become pros at doing Zoom interviews with TV stations. Lisa even, I think in the beginning, did one from her phone. That was before we knew really what Zoom was. I think we were talking about it. We were talking about it yesterday, and she had to do it over Skype, just surviving, we had to make it work. But, and we've kind of just navigated a lot of different things. It's been a journey, but I feel like we've learned a lot and have been able to grow as a program through all the trials and tribulations. So.
And I would say that Joe and his group was instrumental, because I know Joe did some training with our team on virtual telehealth and those platforms to kind of get us up to speed. So we had a little bit of idea of what we were trying to do.
Yeah. You know what? I think it was mutual. I think we all learned something that day. So it was good. Glad to hear the success and the good works that you guys have done since then. It's amazing.
So Joe, you want to go to the next slide? Let's talk a little bit about what's been going on with injuries during the time of COVID. So on the left side of the screen, that data is from the National Consumer Product Safety Commission. So their data is looking specifically at like product related injuries. So you can see that during the time of COVID, there was a drop in ER visits and also school injuries, which it makes sense. Kids weren't actually at school, so to see the injuries decline makes sense. The reason the ER visits dropped is because at the beginning of COVID, families were very afraid to come to medical professionals unless they absolutely had to. So that's why we saw injuries decreasing, because families, it's not necessarily that they weren't happening, it's just that families weren't coming to the emergency rooms and doctor's offices, so we weren't able to capture that data. But you can see where things increased. So families were at home. So what were they doing? They were getting outside. So they were riding bikes and skateboards and scooters. So those injuries were increasing. And unfortunately, as you can see, a huge 93% increase in button batteries. injuries. So if you don't know what those are the little tiny batteries that are in what? Kids' toys. So when you have kids at home and parents at home working and kids at home trying to do school and stuff, those kids are unsupervised. So unfortunately, they were getting those batteries out of the toys and ingesting them. And these are so there you go. Joe's got a picture right there of some button batteries. And when these get into the esophagus, the gastric intestinal juices like break those batteries down and they leach out acids, and they're fatal. They can be really fatal injuries. So also during the time of COVID, because of this increase, the button battery makers have started coating the batteries with a yucky flavor so that hopefully when kids get them in their mouth, they will spit them out before they ingest them. So, you know, that I don't know if that's directly correlated to the COVID pandemic or if that was already kind of in the works and just happened to hit at the right time. Looking at our specific data out of Arkansas Children's Hospital, this data I'm showing here is for the first 6 months of 2020. So from January to June. We are currently conducting a research study through the Injury Free Coalition for Kids with other 40 hospitals. We are all looking at our injury data in 2019 and comparing that to 2020 and 2021. So the data I'm showing here was June through July of 2019 and June through July of 2020. And you can see our drowning dropped drastically, as did our unintentional gunshots. Of course, that was the first 6 months of COVID. So it was wintertime and early spring, so we didn't have a lot of families out swimming. And I suspect, I don't know, this is not any research data or anything, but I suspect that the gun injuries went down is because families were at home and parents were at home. So if there were firearms in the home that were loaded and not secured, parents were there and aware of what their kids were doing. So those kids weren't finding guns and playing with them unsupervised. And as you can see, as the national data, our bike injuries went up. And we also saw this huge increase in dog bites. And so when we were trying to investigate on what was going on with the dog bites, it's because not only were we stressed by COVID, but our pets were stressed by COVID. You know, they were out of their normal routines. It's like, why are my people home? They should be at work and at school. And so we had our young kids playing with our dogs that are already stressed, which caused this increase in dog bites. And then we saw an interesting shift in hot car deaths. So these are kids that are accidentally left in the car and the car gets too hot and unfortunately they die. So usually most hot car deaths are kids who should have been at daycare. Parents forgot to drop them off. Life is chaotic, things change, there might be a crisis, a different parent. And so prior to COVID, most hot car deaths were kids who forgot to be dropped off at daycare. But what we saw during COVID is it was kids actually accessing a car at home and getting stuck in that car and not able to get out. So we had to shift our messaging a little bit to talk to families about ask them and their neighbors locking their cars in their driveways so that if kids are outside playing, they can't get into that car and get stuck. And Lisa, you want to show that hot car book? So we're going to give a plug to Joe Schaffner, who wrote and designed that hot car book. It is now actually for sale on Amazon if you want to get a copy. I bet Joe would sign it for you.
We should find a link and put it in the chat box.
Yeah, we can do that. And so that I just kind of wanted to talk briefly just about where we were seeing injuries going. And Joe, if you want to go to the next slide. Okay, what we're predicting for post-COVID, and this is not, again, based on any evidence, but it's based on the injury prevention professionals around the country, us talking together. This is what we think we're going to see, is we're going to see a continued increase in suicides because COVID has taken a mental health toll on everyone. And even as we get back to, quote, normal, it's still not going to be normal. And so we're going to continue to see an increase in that. What we're going to see, and I forgot to mention this, in Arkansas, we have seen an increase in high-speed motor vehicle crashes. And when I was working with the Highway Safety Office to kind of figure out what was going on, what they said was at the beginning of the pandemic, Most people were working from home, so there was less traffic on the road. Law enforcement officers were actually not out on the road as much as they had been. So that meant the people who were on the road kind of felt like they had free reign to just drive as fast as they wanted. So they were seeing, speeds over 100 miles an hour, 120-mile-an-hour car crashes, and lots of them. So we anticipate as more people start going back to the office and working, and law enforcement is kind of ramping back up to full speed, that we're actually going to see a decrease in 2021 and 2022. And then we also anticipate, besides just suicide, just an increase in other mental health issues, as well, as we all kind of try to figure out how to deal with what's been going on for the last couple of years. And so I think that's all I have to say. Lisa and Shannon, you have anything else you want to add?
And I want to go ahead and just throw out to our attendees to feel free to use the Q&A function, use the chat box if you have any questions for our panelists today. And then I interrupted Shannon. Lisa, did y'all have anything to throw in there?
I don't think
I don't
so.
think I have anything else to add.
I will say, when I see stats and numbers, and I'm going off script here, when I see stats and numbers like 93% increase in like the ingestion of the batteries, increased dog bites, things like that, it always raises other questions like why is that? So I guess one of my questions I have, and feel free if you don't know the answer, is the increase in bike injuries. Do we have any data, or do we know anything about helmet usage regarding?
So not specifically like during the time of COVID, but I and other professionals around the country have said it's probably due to our policies and our behaviors pre-COVID. So we do not have any kind of mandated bike helmet law in Arkansas. It is, just a suggestion. So we don't know specifically about helmet use, but I would suspect it was pretty low.
Yeah. Yeah. So one of the things I love about this whole presentation is that each of you have presented barriers on a number of different levels, everything from, just access to technology to, getting used to the platforms. But you've also offered up, the solutions you've come up with during this time, like Lisa, you said something that came up that you didn't even think about, where your constituents having data plans and being limited in how you can interact with them, or they can interact with you with those data plans. And the solution to that barrier was going audio only, phone only. And that was a big shift in telehealth policy at the onset of COVID. Was the traditional definition of telehealth was that it had to be video and audio. And so since COVID hit, for certain situations, they've allowed audio only. So with that being said, just backing up and looking at each of your mechanisms: teen driving safety, infant mortality, intentional injury prevention. Has telehealth been more or less effective in any of these mechanisms? Like does telehealth lean itself to be more effective in safety baby showers versus child passenger safety? Or
Absolutely.
with recreational safety, you said really it was your partners and the existing channels out there that really allowed that mechanism to continue to be successful.
Yeah, I would say, and I think Lisa and Shannon can speak to this as well, is that our most successful launch into telehealth was our safety baby showers. Lisa embraced that early. She embraced it wholeheartedly, and our families embraced it as well. I mean, we had more people coming to virtual showers than we did in-person showers, because it eliminated some of the barriers that they had getting to an in-person event. They didn't have to find childcare. They didn't have to find transportation. Yeah, there were some other barriers that we had to figure out, but in the grand scheme of things, I think that's been our most successful. I think our program that has taken the biggest hit is anything that we do in the schools. And just because even though the schools embraced the virtual world, what they didn't embrace was outside people coming into that virtual world. They were worried about getting, and they rightfully so. I mean, their job is to educate students. Having outside people come in to do other additional programs wasn't one of their priorities. And so that was the biggest struggle for us, was any of our school-based work almost virtually stopped. And that's where we had to get creative and do things like launching a teen driving Instagram, you know, encouraging our partners who could get into the school to let us piggyback on with them. Does that answer your question, Joe?
Yeah, 100%. And to the teen driving Instagram, you know, Shannon, you said you tried to engage, you know, the teens, but teens are teens. So I'm curious, what sort of engagement or what sort of feedback did you get out of that program, or are you getting out of that program?
Yeah, so it's you know, one of the things that's been difficult because because we haven't been able to get in the schools and really share the word about the Instagram. It's been very, I guess the growth that we have had has been just super organic. We have you know, because we don't have our teen driving crew in the schools where they could, you know, be like, hey, take out your phones and follow this page. It's been solely just on, you know, we have a couple of schools that have their own Instagrams that, you know, we've been able to kind of piggyback off of and encourage them, you know, we've done things with like, you know, refer a friend and then we'll put your name in a drawing, you know, kind of stuff. And, you know, and we try to be cool and funny and, you know, and get them to, to follow and share our posts and everything like that. But, I mean, it's tough to build any social media following, but especially one with teens, you know.
Yeah.
So it's been a lot of one of the things I think during the pandemic is like, you really can't, I mean, it's hard to not be scared to try something new, but you really do, like, you just kind of have to, Lisa had said, you know, like, give yourself some grace. It may not work, but I mean, you're better off for trying. So
Yeah.
that's what we've learned with a few different new things that we've tried. So.
Well, I love it. And I love the work you guys do. Thank you so much for your time and talents today and sharing them with us. Any closing remarks? We don't have any questions from the audience. So is there anything
I have a
else?
question for you, Joe. In your work in telehealth in the virtual world, is there any way that you can like reach out and sort of touch things? Because I'm trying to think about, you know, if there were a way for us to tell somebody, point your phone at the car seat, and then our hand would show up in the view where we could say, point, like specifically point at things. And I don't know really enough about telehealth to know, like during doctor's appointments and therapy appointments and stuff, is there like a virtual way to do that?
So, you know, this may be kind of, well, I'm gonna start in left field. So you started with virtual appointments. You know, we recently had a telehealth roundup on the topic of virtual play. And so this therapist was able to interact with children in real time through Minecraft, the game Minecraft. And so that's not really addressing what you're saying, but it's sort of like it's able to meet someone in a virtual space and interact with them, right?
Mm-hmm.
But other than that, just off the top of my head, and I can do some more research, but they're doing some crazy things with augmented reality, you know, where it's sort of half virtual reality, half real reality. And they're doing some really crazy things with virtual reality too. So let me do some research and I'll shoot stuff your way. But yeah, there's definitely, the technology has been crazy. Like what just the onset of the pandemic to now has forced the conversation 10 years into the future, right?
That's what I think I heard UAMS said, that they made 10 years worth of telehealth advancements in like less than a year.
Yeah. So when a few months into the public health emergency, I heard a healthcare professional say where we're at now is where we thought we'd be 10 years from now, like a couple of months ago. It's just really just, and so with that, you know, the conversations and the healthcare doesn't just change, the technology is just skyrocketing, you know,
Yeah.
as far as just the capabilities and what people are able to do. But let me do some research and I'll,
Yeah, I appreciate that because, you know, as you know, because you used to work with us, that we have people who need car seats all across the state, but we don't necessarily have a technician in every community that can one-on-one help somebody. And we have struggled to try to do it with cell phones and stuff. But if there was some sort of a reality where we could easily engage with a family and kind of touch things and
Yeah.
help them with their car seats, I think that would advance us greatly as being
Yeah.
able to provide the kind of service we want to the entire state.
yeah, that'd be interesting. I'd be interested to conversate a little bit more about that, do some research and talk about some ideas.
Great.
That'd be great. So with that, we will conclude today's session. Thank you so much, Lisa Payne, Shannon Porter, Hope Mullins. And again, thank you for the work you do. Injury Prevention Center, always a big fan. Love what you guys do. It really is changing the landscape of Arkansas out there. I truly believe that. So with that, I'll say adios, have a good day, and stay safe.